There is a very large investment of lottery money in an initiative which is aiming to support people living in quite difficult circumstances in neighbourhoods that are called disadvantaged, to work together, to work collectively to improve the places in which they live. That initiative that is funded by the lottery, and it involves giving communities some money over 10 years, quite a lot of money, sounds £1 million. It's about £100,000 a year if you average it out, to use that money in any ways that they think to make the place a better place to live. So it's about those communities, and it's about them having control over decisions that impact on their lives, that can improve their places. There's been a lot of research about the causes of what we call health inequalities. Now, health inequalities are fairly simple things to understand at one level. That's systematic differences in the experience of health, in the experience of disease, in the experience of dying at young age, in the experience of how long you live. Systematic differences in those aspects of health across social groups. And they're systematic because they don't happen by chance, these differences. They're associated with differences in the resources that you have, the material resources, the social resources that you have. So we call them inequalities. Inequalities in health and inequalities in socioeconomic conditions. Now, most of the research into the causes of those inequalities has tended to be focused on individual factors, like what you eat, whether you take exercise, how much alcohol you drink. So behavioural things, because people living in more difficult circumstances tend to smoke more, they tend to drink more, they tend to eat more of the wrong kinds of foods. But there's also a body of research which is looking at individual control. So the control I have over decisions that I can make in my life. And that research suggests that your sense of control over things that impact on your life and your ability to have control has really positive benefits on your health. The study is assessing or evaluating what impact giving people collective control to make decisions has on social circumstances, on their housing, on the environment, but also on their health, on their sense of well-being, how long they live, those kinds of things.